My Doctor Said What is a program for health information. Be careful that if you want treatment and diagnosis of disease, you need to go to your local healthcare provider.
Hi, this is Dr. Frank from My Doctor Said What? You can find my podcast on YouTube, Spotify, iHeart, Amazon, Apple, all major podcast channels. And my Instagram and TikTok, you can find me at Dr. Frank _ My Doctor Said What, no spaces. And my last two TikToks will give you a little tidbits for between 1 and 2 minutes. The first was how to milk a nut. No, it was not a porn video. It was about almond milk, soy milk, oat milk, etc. versus dairy. And the second one was about bad sex, about STDs and prevention. Wrap it before you tap it. So remember those things. This is plain talk about your health to help you live a better life, have a better 23 and 24 from a pathologist, toxicologist perspective. I'm the guy that looks in the lab at your different cell types, spent a career doing that. And I believe, like Albert Einstein said, if you can't explain it simply, you don't understand it well enough. So I'm here to make health care simple, disease progression simple, and most of all, prevention simple. So with that, I'd have to say a couple things we're going to talk about today. A couple fun fast facts first. Some of them aren't as fun as they could be, but stay hydrated. We talked about that several times. Make sure, especially in these summer months, that you drink plenty of liquids that aren't caffeinated and not full of sugar. Water's great. Gatorade is okay if you're an athlete, but you got to watch your sodium. Couple other things, like I said, if you like it, drink it if it doesn't have too much sodium or caffeine in it, and that will keep you hydrated, which is really important for thermoregulation so you don't overheat, get heat stroke. Bad time of year to do that. If you ever start feeling kind of nauseous or fatigued when you're out in the sun, get inside, drink plenty of water, and cool down. It's really important that you do that. Just like when you shovel snow in the winter, if you start feeling pain in your chest, go inside. Call 911 if it doesn't go away quickly, because you may be having a cardiac event. Got to be careful. Some of those times when you stress with thermoregulation issues, you can really cause some issues with your health. So be out there, be careful. The other quick fact, and this is really important, people don't think of this. If you have a water softener in your house, it fills your water with sodium. So you normally will plumb the sink in your kitchen, the one that you use for cooking, for filling the pet dishes with water and drinking your own water out of, is not connected to the softener. You do not want that high sodium softened water to be consumed by you or your pets or in your cooking at all. You don't want to ingest it. And if you haven't thought about that, think about it. If you have to follow the line or get a plumber, make sure that that main faucet that you use to drink and to get water for your pets, etc., as well as cook with, you want to make sure that is not softened water. On my previous podcasts, you'll see that you might also want to have some filters in that are relatively inexpensive with activated charcoal, or a little more expensive, you want to go to reverse osmosis under your sink to have some great water. But the big thing is, just don't have it hooked up to your water softener if you're going to drink it. It's okay to shower in, all those other things, but it is not useful for ingestion. With that, I want to talk about a very important topic today: back pain, joint pain. Back issues affect 60% of Americans over 35 years old. Think about that. You realize that most back issues happen if you talk to orthopedists in your late teens, early 20s to late 20s. Usually things you didn't realize you were doing, lifted something too heavy, twisted, didn't lift something correctly, played sports, had impact, had trauma. If you look at x-rays, as one of my orthopedic friends, orthopedic surgeons said, 7 out of 10 people when they're in their early 30s have disc issues. And those will end up pressing on the nerves for about 2 out of those 10. The other 5 won't even know it till they get older. But what happens is you get pressure from that disc, which is just in between the vertebrae. It's just a gel-filled membrane encapsulation, kind of like a baggie that's tough. And as it pushes out or herniates, it pushes against nerves. And that's why a lot of people have like sciatica, which can run from the top of your pelvis all the way down to your toes. It can cause numbness. It can cause real pain. It can feel like you're having muscle cramp in your hamstring or your hips. But there are, other issues like T-bands in your hips as you get older, or you do a lot of cycling like I do, that tend to get really stiff. I can tell you the best thing you can do for your back, your shoulders, your elbows, all your joints, because you are going to have small injuries over time, and that leads to osteoarthritis. And that's a buildup of calcium where injured tissues, tendons, muscles, all that, especially around joints, will end up getting these rough edges. If you ever look at calcium under a microscope, it kind of looks like burrs out in the field. It's really got spiky twinges on it, and that cuts and touches nerves and hurts and makes you have chronic pain. Then you have to spend a lot of time on things like ibuprofen or Aleve, NSAIDs, so that you have a reduction in inflammation. And if it's really bad, you have to get on things that are related to prednisone, steroids, and none of those are all that great for your liver. So the longer you can prevent that, the better you'll feel. And the best way to do that is, again, avoid lifting things incorrectly, hurting yourself doing something, especially in the mornings when you're not warmed up, you're rushing to work, or you're rushing to get out and do something in the yard. Make sure you stretch a little bit. For those that do yoga, Pilates, simple stretching movements, awesome. Best thing you can do for yourself, especially as you get older. And when I say older, I'm talking about when you get beyond your mid-30s. The more you stretch, the better you'll feel. It's good for your circulation, good for your nerve health, good for your joint health. You want to make sure you do that. If you think you have an issue, go to your general practitioner, your health provider, your physician's assistant or nurse practitioner. Have them write for an x-ray in the issues along your spine that hurt, or in your shoulder, or in your knees, or your ankles. Take a good hard look to see what you got going on. It'll tell you if there's hard tissue like bone damage or tendons at the ends, or just muscle issues. And hydrotherapy is a wonderful thing for a lot of that. What's hydrotherapy? It's a nice warm bath. And for people that don't like baths, you're not trying to clean yourself up. You're trying to let circulation increase just like exercise, so that that blood gets to those joints where there's lower blood flow, and has the ability to remove some of the irritants such as histamine that are released there, and the calcium that happens depositing over time. So think about that. And prevention is still the best key. Walk a lot, move a lot. You will rust out long before you wear out. So keep moving, keep walking, keep doing things. I'm a big fan of resistance exercise for bone and joint health, but you have to do proper form. Don't go too heavy. You're not trying to be a bodybuilder. You're just trying to keep muscle mass, keep your bone density strong, and you want to make sure you have flexibility. That's why gymnasts and dancers are in awesome shape when they're young, but they have a lot of injuries as they get older because they've just had a lot of abuse in those joints. And so you need to be careful. Think about the long term, what you're trying to do. Now, if you're making millions of dollars a year as a professional athlete, hey, that's a whole different story. That's a risk-benefit issue you'll have to take up with your family and yourself. But for most of us, we want to stay limber, flexible, and happy for the rest of our lives. So you want to make that as long as you can without having a lot of aches and pain. For those that work at a desk, neck pain, trap tensions, all kind of issues with your neck, going from one side to the other, or looking down at your phone all the time or computer, can be a real issue. Now, I will say this, and this is not going to be popular, but as my orthopedic friends would say, I'm a big fan of therapeutic massage. I think it's a wonderful thing. If you can treat yourself and afford it, it's awesome to do on occasion. But chiropractors, and I hate to tell you this, but manipulation of the spine is not shown to really be effective in the overall scientific research. You need to go to an orthopedist and find out what's wrong, and then try to approach that problem from a structural perspective, and to see what it is and see how to address it. And usually that's by stretching, being limber, doing all those kind of things that you need to do to be healthy. So with that, I would say also supplements. There are really no supplements you can take. The ones they sell for joint health, unless there's something unusual, really aren't a big issue. If you're a woman over 40, like I've said before, you need calcium, vitamin D, and iron in your daily regimen of a supplement or your one-a-day vitamin, which I highly recommend. So with that, in ending, I want to tell you something interesting people get confused with. Diabetes, type 2 diabetes, that's adult onset, that is brought on a lot of times by excess weight or lack of activity. Again, if you exercise, change your diet, can make some incredible strides with that, unlike type 1, which is where your pancreas just does not produce insulin correctly from being an infant or from birth. But type 2 is very preventable. It's very prevalent in our society. It definitely tracks its incidence with obesity. And that's when your blood sugar is too high because your pancreas is not producing enough insulin to balance that out. Then there's something like I have called hypoglycemia. That's the opposite end of the spectrum. When I get blood sugar, what I end up doing is I dump too much insulin and get rid of the sugar too quickly because my kidney filtering system, my glomerulus, has a little bigger screen than most people, so it lets a lot of excess sugar out into my urine, which can be mistaken sometimes on tests to be diabetic, but that's not the case. So that's totally different, and I can control that not only by controlling my weight, but I have to eat on a schedule about every 4 hours, and I have to eat something that is not a spiker of blood sugar, but more complex carbohydrates, which are much better for you. Not candy bars, but eat something with a high carbohydrate, complex carbohydrate mix with the proteins and some good fats. So if you're hypoglycemic, or if you know someone that is, remember that distinction. Two different diseases that result in the same kind of issues. If you're thirsty, if you feel nauseated, if you urinate a lot at all times, not just at night, you might check in to see how your blood sugar is doing. Very important on your yearly physical that you find that. And in closing, I'll say another quick fun fact. I talk about dentists and how important it is to go to dentists at least once a year and hopefully every 6 months. Find one that'll take cash pay if you don't have dental insurance, and you'll find that it's pretty reasonable, and find a dentist you like. But don't get x-rays all the time. I think x-rays every couple of years, and I know my dental friends will have a little issue with this, but you got to remember, you've got some very soft, vulnerable tissues that you're exposing to fairly strong radiation. I don't care what they tell you from a pathologist point of view. And not only that, your noggin, your brain's right there. So you want to be careful about having too many x-rays in any incidents. And are they important for some things? Sure they are. And they're important routine for dental work, but not every 6 months or every year. That's just, you don't need that unless you're having some kind of problem that needs to be looked at. But at routine ones, every couple of years is plenty. I'd like you to have a wonderful day, and this is Dr. Frank. Go to my Instagram or my TikTok. It's Dr. Frank _ my doctor said what? No spaces. And you'll get the 1 or 2 minute update every week, as well as my 15-minute podcast like this that comes out every Tuesday around noon. Have a great day, and you can see the archives anytime you want. I'm also on Facebook, so look up Dr. Frank, my doctor said what. Have a great day and a healthy 2023.
Remember, send your comments and questions to Dr. Frank at mdswpod@gmail.com.